Respiratory alkalosis. Description: respiratory alkalosis is a condition characterized by a deficit of carbonic acid and a decrease in hydrogen ion H concentration, leading to an increase in blood pH, alkalemia. This imbalance results from hyperventilation, where excessive carbon dioxide CO2 is expelled. Below is an expanded and organized version of the content you provided, along with clinical correlations and rationale for each section. Respiratory alkalosis. Description: respiratory alkalosis is a condition characterized by a deficit of carbonic acid and a decrease in hydrogen ion H3's concentration, leading to an increase in blood pH, alkalemia. This imbalance results from hyperventilation, where excessive carbon dioxide CO2 is expelled, reducing the carbonic acid H2CO3 levels in the body. Pathophysiology: the decrease in CO2 due to hyperventilation shifts the carbonic acid bicarbonate buffer system to the left, resulting in reduced H-pies ions and alkalosis. This disrupts the normal acid-base balance and can affect multiple organ systems. Respiratory alkalosis is often a compensatory response or a direct result of underlying conditions, highlighting the importance of identifying the cause to guide treatment effectively. Causes of respiratory alkalosis. Respiratory alkalosis arises from overstimulation of the respiratory system, leading to hyperventilation. Possible causes include 1. CNS stimulation, anxiety, fear, pain, or stress, psychogenic causes, fever or infections, brainstem injury or encephalitis, hyperthyroidism, metabolic stimulation of respiratory centers. 2. Hypoxemia-induced hyperventilation, high altitude, severe anemia, pulmonary embolism or pneumonia. 3. Iatrogenic causes, overventilation in mechanically ventilated patients, mismanagement during general anesthesia. 4. Drug-induced salicylate toxicity, catecholamines or stimulants. Rationale and correlation. Understanding the cause is crucial for targeting treatment. For instance, managing anxiety-induced hyperventilation differs from addressing hypoxemia caused by a pulmonary embolism. Clinical manifestations of respiratory alkalosis. Neurological symptoms: dizziness and lightheadedness result from reduced cerebral blood flow due to vasoconstriction caused by hypocapnia. Confusion and headache reflect altered neuronal function and electrolyte shifts. Cardiovascular symptoms: hypotension and tachycardia reflect decreased cardiac output and compensatory mechanisms. Dysrhythmias may result from hypokalemia or hypocalcemia secondary to alkalosis. Gastrointestinal symptoms: nausea, vomiting, and epigastric pain, possibly due to reduced perfusion and electrolyte imbalances. Neuromuscular symptoms: tetany, numbness, tingling, paresthesia, and hyperreflexia result from a reduction in ionized calcium levels due to alkalosis. Hypocalcemia increases neuromuscular excitability. Seizures, rare but possible in severe alkalosis. Respiratory symptoms: initial hyperventilation, the primary cause of the disorder. Secondary compensatory hypoventilation if metabolic mechanisms attempt to restore balance. Clinical correlation. Symptoms guide the urgency of intervention. Neuromuscular signs such as tetany suggest severe electrolyte disturbances requiring prompt management. Assessment of respiratory alkalosis. A structured assessment helps in identifying the severity and underlying cause. 1. Subjective findings. Patient reports dizziness, lightheadedness, or numbness, anxiety or stress-related triggers. 2. Objective findings. Increased respiratory rate and depth, hyperventilation. Laboratory findings: arterial blood gases, ABGs, increased pH 7.45 and decreased PaO2 in 35 mmHg. Electrolyte imbalances: hypokalemia, hypocalcemia. Rationale: regular monitoring allows early recognition of complications such as arrhythmias or seizures. Interventions for respiratory alkalosis. General measures: 1. Monitor for signs of respiratory distress. Identify early signs of worsening alkalosis or hypoxemia. Rationale: prevent complications like respiratory failure. 2. Provide emotional support and reassurance. Alleviate anxiety or fear-induced hyperventilation. Rationale: psychological factors can perpetuate hyperventilation. 3. Encourage appropriate breathing patterns. Promote slow, regular breathing to retain CO2. Rationale: rebalancing CO2 helps restore acid-base balance. 4. Assist with breathing techniques. Use rebreathing aids, paper bags, rebreathing mask. Rationale: these devices increase inspired CO2, correcting hypocapnia. 5. Careful ventilator management. Avoid setting parameters that encourage excessive ventilation. Rationale: iatrogenic alkalosis can exacerbate symptoms. 6. Administer medications as prescribed. Calcium gluconate for tetany or severe neuromuscular symptoms. Rationale: corrects hypocalcemia to prevent complications like seizures. Complications of respiratory alkalosis: neurological, seizures, impaired consciousness. Cardiovascular: persistent arrhythmias due to electrolyte imbalances. Musculoskeletal: severe tetany, muscle cramps. Rationale: recognizing potential complications ensures timely interventions to prevent morbidity. By systematically addressing the description, causes, clinical manifestations, assessment, and interventions of respiratory alkalosis, this framework aids in both understanding